everyone, welcome to the second series of the diabetes videos that I want to do. Last time I did a frequently asked questions and talked about insulins and injection sites, and today I'm going to be talking about blood sugar machine and why we have to test our blood sugars and things like that. I have got a few little notes with me just to help me along the way, so if you see me looking down all the time, that's what I'm looking at because I'm not going to remember everything out of the top of my head, and it will just help me to flow my sentences a bit better. So the blood sugar machine that you get will always be different. I have gone through so many different blood sugar machines, but the one that I have got at the moment is one called Accu-Check Aviva Expert. Just here I keep my little needles. These actually come in little packs of 6, which I will show you now. This is what they look like. There are actually 6 needles located in these little holes, but you can't actually see them. And this just releases the needle, which pricks your finger. Then I have got my pen, which has the little lancets inside, which I will show you now as well. So they're just in here, and that is where you replace them once they have run out. And you know that they have run out because there is this little number here. If you twist it, it goes down. So every time that you finish testing your blood sugars, you wind that little button just there, and it gives you a brand new needle. But just there you can see that that is where the needle is released. You can also up or down the pressure of the needle. So if you've got thicker skin, then you want a higher pressure. If you have thin skin, you want a lower pressure. Mine is kind of in the middle, so I've got mine on 3. To inject yourself with it, you just push this down all the way, and this goes yellow. And then to inject yourself, you just push this button and it pricks you. But like I said, if you have this pen, then it will be good for you to know this information. But if you don't, obviously, if you've got a different one, then this information is pretty useless. But I'm just showing you what I have. Of course, you get these, which are the testing strips where you apply your blood. These come in packets of 50, so they're just stored in here. This is what they look like this, and obviously the blood goes onto the little yellow bit at the end. And then last but not least, I have my little machine. BG test is blood glucose test. That's what you would press if you wanted to test your blood sugars. Then you would insert the little strips just at the bottom here. Then you have a bolus advice, which is just if you wanted some information on how much insulin to give. This isn't going to make sense to a lot of people, but basically this is one of the best machines if you do carbohydrate counting, which I will come on to in a different video. This machine basically does everything for you. You input the information like how much carbs you're eating in your meal and what your blood sugar is at, and it works out how much insulin you should be giving to what you're eating and what your blood sugar is. My data is obviously all the history of my blood sugar readings are. So yeah, that's really useful. And then if you go to reports, you can see your blood glucose averages over 90 days, 60 days and 30 days. And this just helps you work out what your HbA1c is, which I will explain in a minute. But yeah, this machine is just really good. You can also transfer your data onto your laptop if you want to. I've never done that personally. There are settings which you can change, so there's reminders, there's bolus advice, which I showed you at the start. Meter, I'm not quite sure what that is. Oh, warning limits, key lock language units, sound, vibrate, time and date. I've actually never touched the settings before, although when you get your machines, obviously you get the instructions with them. So if you do want to mess about with the settings and stuff, you can. Although my diabetes nurse or my doctors usually do that for me. So then obviously you've got your brightness key, so you can turn up the brightness or turn it down. And yeah, it all comes in this little compact, which is really nice to obviously have in my handbag all the time with me. Okay, now on to why we have to test our blood sugars. So, we test our blood sugars for a number of reasons. One, to make sure that we are in the normal range of someone who doesn't have diabetes. Also to avoid going hypo, which is when your blood sugars drop too low. And this can be really, really dangerous, because if your blood sugars are dropping too low and you're not aware, you could eventually go into a coma. So you would start to feel some symptoms of going low, and you would also start to feel symptoms of going high. But I think that I'm going to be talking about the two, which is hypoglycemia and hyperglycemia, in another video. Also, you need to avoid diabetic ketoacidosis, which I know is a long word, but this is something which I'm going to talk about more in the next video, which I'm going to do. What do we mean by blood glucose control? So basically, the normal range for someone that doesn't have diabetes is, before breakfast, your blood sugars should be between 5.5 and 7.5. Before meals, they should be between 4.5 and 7.5, and before you go to bed, they should ideally be 6.5, between 6.5 and 8. For someone who has diabetes, their blood sugars are going to be higher than the normal range, and this is why we have to give insulin, and also this is why we have to test our blood sugars, because if they are high, so higher than 10, let's say, for a long period of time, that is when you can start to become really, really unwell. If you get a high blood sugar reading once in a while, as long as it comes back down to normal, that is fine. It is when your blood sugars are just constantly high over a long period of time that you cause yourself a lot of harm. When do I test is one of the questions that a lot of people ask me. I tend to test every morning as soon as I wake up. Before I have any food or any meals, I always test then, and I also test before I go to bed. Test your blood sugars, and if you eat something, after 2 hours, that is when your blood sugars are at their highest. That's when they're at their peak. And then your insulin, your fast-acting insulin, which I mentioned in the first video, it runs out after 4 hours. So after 4 hours, that's when you can kind of test your blood sugars again and see if they have come down and if the insulin has worked. I also test my blood sugars if I'm not feeling very well. If there are days when I'm feeling ill, I tend to test more just to see what my blood sugars are doing. I test if I'm feeling low. So when I refer to feeling low, I'm referring to if I'm feeling hypoglycemia, but we just call it feeling low. If I start getting the symptoms of hypoglycemia, I will test to make sure that I am actually going hypo. And also I will test if I have the symptoms of hyperglycemia. Another question that I get asked a lot is, where do I test my blood sugars? A lot of people do see me doing it, but they always ask if I do it anywhere else apart from the area which they see me do. Basically, the areas which I test my blood sugars in are my fingers. In particular, these 6 fingers. The reason that doctors don't really suggest or recommend that you inject in these 2 fingers is because these are the fingers that you mostly use to pick things up, even though we don't subconsciously, we're not aware of that subconsciously. I think it's because it's the best area in which to test a blood sugar level or a glucose level. I'm not actually too sure, but I will research into that a bit more, and on my blog post I probably will have wrote why testing in your blood sugars is the best place. Normally glucose sticks to the red blood cells and tissues of the body. So the higher the blood glucose, I can't speak, the higher the blood glucose, the greater the amount of glucose that is attached to the blood cells and the tissues. So the more glucose that you have attached, the greater the risk of diabetes having complications. And this is where HbA1c comes in. HbA1c is basically a measurement of the amount of glucose that you have stuck to, parts of your bloodstreams. And this is measured over an 8 to 12 week period. Basically, your HbA1c result gives you an idea of if you have risks of developing complications. So the higher the number above the non-diabetic range, the greater the risk. Now, people who do not have diabetes, their HbA1c will be on average 42 millimoles per litre. So this is what someone with diabetes has to try and target and reach. And in order to reach that target, you must have normal range of blood sugar readings. I know this is really complicated. It's quite complicated for me to even explain it to you guys, so I can imagine how hard it is for you to take all this information in and kind of store it in your brain, or even keep up with what I am talking about. Doctors and people who research diabetes believe that the best HbA1c for people that do have diabetes is between 45 millimoles per litre and 55 millimoles per litre. If it is below 45 millimoles per litre, you could risk having defences against hypoglycemia, and it is better to be slightly higher than the normal range and avoid being constantly hypo, as we say for short, because you don't want to keep risking going into a coma. Having a HbA1c of above 55 millimoles per litre is also not really recommended, because long-term complications can develop. If you're looking to become pregnant, it is very important that you keep your blood sugars under control for at least 3 months prior to considering having a baby or planning to have a baby or getting pregnant. And this is just so that you and your unborn child can both have, the benefit of a healthy pregnancy and no complications long term. In October 2015, my HbA1c was 99 millimoles per litre, which, if you think about the range that you should be in being 45 to 55, 99 was really high, and it's been even higher. I had a point where I was at 111 millimoles per litre, and that's because my blood sugars were constantly high all the time, and it really made me unwell. December 2015, I managed to hit the target of 76 millimoles per litre as a HbA1c, and my last one, which I think was before I went to Greece, was 64 millimoles per litre. So I am slowly being able to control my blood sugars a lot better, and my HbA1c is slowly coming down, which for me is going to be beneficial in the long run, as it's going to prevent kidney problems, eye problems, nerve damage, and a whole load of other complications that diabetes can give you. The relationship between blood glucose and HbA1c can be a little difficult to understand, but basically if your blood sugars are under 7 for the 8 to 12 week period, then your HbA1c result will be in the normal range, so they will be between 42 to 53. If your blood sugars are frequently over 10 over the 8 to 12 week period, then you will come out with a HbA1c of 64 to 108 millimoles per litre. Things are really bad for you and you're going through a really hard time in trying to control your blood sugars, and your blood glucose are... Blood sugars and blood glucose, by the way, are the same thing. I just find it easier to say blood sugars. But if they are mostly over 17, then your HbA1c will be over 119 millimoles per litre. If this video has helped you understand why people with diabetes have to test their blood sugars regularly, if you do have any questions, like I said in the previous video, do let me know in the comments below or any of my social media. And as I did last time, I will also link down below my blog, which I always go into more detail about what I have spoken about in the videos. Next time I will be talking about ketones and ketone machines and what diabetic ketoacidosis is. So make sure to subscribe to my channel if you want to see that video next. Please check out the previous video, which I will link down below. If you enjoyed this video, give it a big thumbs up. I hope that I have been able to reach out to some of you, or at least one of you out there who is living with type 1 diabetes. Or if you do not live with type 1 diabetes but you simply want to know more information about it. Thank you very much for clicking onto this video today, and I will see you soon for another video. Bye!